if we look back to the origin of the word doctor in Latin, docere, it means to teach. So I felt that it was my role to teach people how to take care of themselves. And that in
Yeah.
actual fact, any symptom that they were experiencing was simply information.
Yes.
If we had to code that as a diagnosis, okay, that is the framework within which we operate. But the diagnosis should not be the end point. It should be the starting point.
You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time.
Donna Hutchinson is here with us today on the podcast, and she's a highly experienced UK-based medical doctor with 28 years in family medicine, holding a master's degree in sport and exercise medicine and advanced training in functional medicine through the Institute for Functional Medicine. She brings a holistic approach to patient care. As a Heart Math registered coach and founding member of Dr. Joe Dispenza's Inner Health Coalition, Donna integrates mind-body medicine into her practice. She works in private general practice and within the NHS, providing medical supervision and for therapists treating dysautonomia. With nearly 4 decades of lived experience as a patient, she offers deep empathy and insight into healing. Donna, welcome to the podcast today. I'm really excited to have you here.
Thank you so much. And in preparation for this, I looked at previous podcasts that you've done and looked at some of the people you've had on. And I'm just so delighted to be amongst a community of wide-ranging practitioners with their experience. And it's just so wonderful that more and more people are coming into this movement that we need to do things differently.
Yeah, I appreciate that. That's one of my goals too. When I started this podcast, it was like, okay, I have so many things I want to say and get out there, but there are so many other people that bring so many different views and perspectives and different treatment modalities to just a holistic lifestyle. And I've met so many amazing people throughout doing this that are experts in so many different things I never even knew about before. So it's been just a really awesome experience. And I'm really happy to have you here today. Now, I know you've been practicing medicine for almost 3 decades. So what was it that made you want to go into medicine originally?
I think for me, and perhaps also for a lot of other practitioners, it was seeking something that was seeking us. So I think we are shaped by our personal experiences, and
Yeah,
we either grow through that or we don't.
I agree.
We go through a period of contraction. And if we don't release from that into that natural rebound expansion, we can remain really stuck. And so for me, my experience was in my teens developing what we would now refer to as an invisible illness. So becoming incredibly unwell and not knowing what that was, and having a mum who was fiercely protective and my advocate at seeking different medical consultations to try and understand why her daughter was as unwell as I was.
Yeah.
And I think that experience made me understand that the care providers that I interacted with were very close-minded. And the information that was provided to me and my parents at the time, I was eventually diagnosed with systemic lupus, was that this carried a very poor prognosis and that my life would now have to be shaped within the confines of that diagnostic label. And
Mhm.
alongside that, many other disorders manifest because it is a multi-system disorder. So there was chronic migraines, but there was also perhaps one of the most distressing experiences for me was depression. Because at that time, and we're talking in the 1980s, it was not considered that a child could be depressed. And
Yeah.
so for me, it was a case of, if this is my reality, I'm very fearful of this.
Yeah.
And having gone through that, I made this decision that I had two ways to go. I could either surrender to this, whatever would be, and I truly believe that that would be my death, or I could use this as an opportunity to think, I don't know what is possible. And I think that is what's shaped my career.
Mhm.
And I know you will probably have the same opinion that when we go through the functional medicine training, I don't believe I'm an expert in anything. And I certainly don't believe I'm an expert in the human body or how the mind body operates. But I do believe that I have practiced and continue to practice deep listening.
Yeah. Yeah. I love how beautifully you described that, though. Just when we're given a diagnosis and something like lupus, it can be hard to diagnose at first because there's so many different factors and different symptoms you're experiencing too. But it does put you in a box. And it gives this mindset of it's this diagnosis, death sentence. Even if it's not right away, if this is your diagnosis, then this is your new label. And I do think a lot of people search for that label because they want the answers. But turning to functional medicine, it's like you said, you're not necessarily the expert. I don't consider myself the expert because we're constantly learning all of these new things and things we didn't know were possible before. And even when you were diagnosed with lupus, all the things you were experiencing and depression as a child, there's just so many possibilities there to help and so many different modalities of treatment now and things like that. How was your illness perceived by medical school's admission?
The door was very firmly put in my place, as in it was closed. And I remember going to an interview at Cambridge University, and perhaps that has the same kudos as Yale or Harvard would in the States. So
Yeah.
I went to Cambridge University and they have a fairly protracted interview process, and there are various tests and so on and so forth. And I had an interview panel who said to me, "You have lupus. Perhaps you should put these ideas on hold until you are better." And I had always been an incredibly quiet child. And I believe this is true of many women in particular that develop autoimmune illnesses and chronic health concerns, in that they are people pleasers who put their own needs way down the priority list after looking after everybody else. But there was something in me that found a voice. And I think this is part of what is your purpose. And I said, with all due respect, and I always say that now sort of tongue in cheek, because there's almost that little part that says, don't really respect what you're saying to me, but I am going to acknowledge you and give you the respect that is deserving of your status. And I said, with
Yeah.
all due respect, this is supposed to be a chronic condition. I don't know when it's going to remit or relapse. I cannot wait to start my life. Please don't shut that door in my face because I don't know until I can try. And they did offer me a place that was conditional to getting the very highest grades or score average, I think your GDA or whatever it's called in the US. And by virtue of the fact that I had then spent quite a lot of time in and out of hospital going through my exam process, I didn't achieve those grades. But I was accepted to medical school, and I believe I was accepted to the medical school that was right for me because it was
Yeah.
very forward thinking. And I
Yeah.
think this is very useful when we do a cognitive reframe. We can easily surrender into victim status. And sometimes that is how we have that felt sense or experience when things seem to be stacked against us. But the more I've navigated through life, the more I do that with a greater sense of ease because I have that acceptance that whatever is transpiring is supposed to be. And I
Yeah.
will trust in that, wherever that is coming from. And whether somebody has religious beliefs or spiritual beliefs, there is something beyond me that helps guide me.
Yeah. I love that. Now, what was it like for you to be the patient for years and then be the doctor?
It's been an interesting journey. So, as a patient, and all of the patients at some point,
Yeah.
some of us more often than others. But as a patient, historically, I would simply take the doctor's opinion or recommendation at face value.
Which
But
I think
then
is
I would
very common.
absolutely.
Yeah.
And so you are being done to. And the words that they use in that communication are very powerful because they plant a seed.
Yeah.
But I started to question the validity of what they would say because I felt, but you have 10 minutes with me. You don't know my life. Those 10 minutes, how does that translate to every other moment of my life? It doesn't. And so I had a bit more courage in saying things like, does diet have any impact on this? Does stress have any impact on this? And even to this day, and I'm sure this will be a shared experience from some of your listeners, a lot of doctors, not all, but a lot of doctors will not give any due attention to any of those aspects, which seems so limiting.
It does. It
When
is.
I then became a doctor, also still a patient seeking my care provider's attention, it was difficult in that there was a sensed perceived threat by me to the doctor. So when I was then having the dialogue, and I was aware of this when I went to some of my clinic appointments, that my consultant would put my notes to the bottom. I'm not going to see her next, or I'm going to give this to one of the residents. And I'm
Mm.
thinking, I wonder what it is that I'm broadcasting that they do not like this interaction with me, because I think I'm quite personable.
Yeah.
I wish to have a dialogue with you. And there are times as a physician that we just want to be a patient.
Yeah. Yeah. I'm sure that your experience with being a patient and becoming a doctor has definitely shaped how you treat your patients and the kind of doctor that you are. So I think that, like, that alone, just the struggles that we go through with our own health concerns, the beauty in it is that we get to learn from that and then help other people. How has that shaped your practice, though? Like, you going through your own health struggles, how has that impacted how you are with your patients?
I definitely have a very different way of communicating. And one of the things that I decided very early on in my career is that, okay, there is guidance within which we are reported to have to stick to in medical management. And it's very different here in the UK in terms of it is not a coding of a diagnosis in order to be billable. But nevertheless, it is important to have this coding within a patient record because that would suggest a particular pathway or protocol. So when I had my interaction with patients, I decided very early on that my main role was to make myself redundant. And what I mean by that is if we look back to the origin of the word doctor, in Latin, docere, it means to teach. So I felt that it was my role to teach people how to take care of themselves. And that in
Yeah.
actual fact, any symptom that they were experiencing was simply information.
Yes.
If we had to code that as a diagnosis, okay, that is the framework within which we operate. But the diagnosis should not be the end point. It should be the starting point. We should say, now that we have this understanding that your symptoms and signs would give rise to this diagnosis of inflammatory bowel or endometriosis or chronic migraine, now let's work backwards. What is it that you are not tending to that requires your attention? And rather than going down, for example, the functional route, which certainly not everyone can afford, it is certainly not accessible to us in social care medicine, they would go back to the foundations. And we know from the functional medicine route that they are absolutely imperative to get right, because if we do not have good foundations, then we cannot build on that.
Yeah.
And some of my colleagues would say to me, "Oh, your patients are so frustrating." And I would say, "In what way?" And this would always make me laugh because I was thinking, gosh, we really are coming at this from different angles. They know so much about themselves. Yes.
That's a good thing.
One would hope that they would. But I would have patients who we would put together their file so that if they did not see me, they were going to the emergency department or whatever, and they knew under what circumstances they needed to attend the emergency department. They would have all their lab results up to date. Those individuals, for example, who had renal failure or heart failure, they would know what their electrolyte function was. They would know that taking a weight would be useful to see, okay, did they need to do a tweak of their medication? And in doing it in that way, there is a very different doctor-patient relationship. And I would always introduce myself to my patients. I am Dr. Donna Hutchinson, but I prefer to be called Donna. Is that okay with you? And what would you like me to call you? Because historically, and my own experience was that the doctor was somewhere up here, patient was down here. If we actually do the correct calibration of that, it should be more like this. And
Yes.
what I am hopeful for is that I can give you that felt sense of safety and empower you to unlock your own healing potential. It's the
Yeah.
two most important systems of the body are our language system and our nervous system.
Yeah. I love that. It puts it back into their hands instead of like you being the authority figure who's managing this diagnosis for them. You're teaching them how to take responsibility for their health, how to understand it. And that's something that when I was working in clinic, I always told my patients if they would tell me something, but maybe it wasn't evident in the lab work or something, it's okay. You know your body so much better than I do. I know the information, right? Like I went to school and learned the information and know more about that than say you did because you didn't go to school for this. So I'm here to share the information with you, but we're a team and this is the information. This is how you need to utilize it and how these symptoms you're experiencing, how you need to recognize what to do. And I love that. I love to hear that there's other providers out there taking that approach too. And you've conducted over 130,000 consultations. What do you think is the biggest thing that you've learned from all of that?
First of all, my patients are my very best teachers, for sure. If we could rewrite the book of medicine, oh, it would look so different.
Yeah.
I think when we go to college and school and we're doing our medical training, it gives us a foundation. But we need to then have a flexible mindset to look at that information in the context of the person sitting in front of us.
Mhm.
And over all of those consultations that I've done, we can do lab work and we can look at the pillars of lifestyle medicine, but the resounding recurrent theme is whether people feel that they are allowed to be their authentic self, whether they have found their true purpose, and whether they are truly loved. If I look at all the lessons that I've learned, and I've been so privileged, honestly, I think my colleagues used to laugh at me because I would say, I love my patients. And they would say, "You're that person." And they would try to conjure up somebody that they thought was especially difficult or challenging. And I would say, yes, especially that person. I learned so much from that person. And a lot of the difficulties appeared to arise from some sort of traumatic experience. And it's not true to say that every single person will have experienced adverse childhood events or that every single person will have a knowing of what a distress situation or circumstance may have been for them, because you don't have a yardstick at which to measure it against. Your life and your experience is your life and your experience. And a lot of this is shaped by cultural beliefs, your socioeconomic status, the resources and resourcefulness that may have been available to you, a stable family system or not. There are all of those things. And I used to question this person, and this was in my early years of navigating through medicine. This person, why do they appear to be making the same repeat poor decisions? And then I would reflect on, I don't think it's possible to make a bad decision. Subconsciously, nobody makes a bad decision. They make a choice and take action on the information that is presented to them at that time and within the bandwidth and the resource within which they are able to deal with that. And that's often associated with the emotional state they are experiencing and also the relative energetic that they have. And when
Yes.
I had compassionate conversations with those individuals, people would have their aha moments. We often talk about how it's difficult to take action because we are fearful of coming out of our comfort zone. And I would argue that it's typically not our comfort zone because there may be many things about it that are not joyful, healthful, positive, or life enhancing for us, but it is our familiar zone. And within that familiar zone, we know what to expect.
Yeah.
And so that's easier to navigate because it
Yeah.
feels more controlled. It's already within your experience.
Yeah.
You know what to do.
Yeah. Even if it's not comfortable, the familiarity of it is, for lack of another word, brings comfort, but it's not that
Mm.
it's easier or the best choice. But I love how eloquent you are with your words, and your vocabulary is just beautiful, and I just enjoy listening to you talk. But whenever people really feel heard and feel loved, they can be their authentic self. I do agree and think that's whenever these walls break down. I did have a patient one time who had a list of a few questions and was so apologetic that they had the questions beforehand because they thought they were going to be taking up too much time. You could tell that they felt like, okay, I can't ask these questions. I haven't been able to before. And I was filling in for another provider. So they weren't my patient normally. So I was like, okay, this is what they're used to. But I told them, I was like, this is what I'm here for. I hope to have the answers to these, but this is exactly what I'm here for. And they were so appreciative of that. But that's how it should be when you go to your provider. That's how it should be. And that was just really eye opening for me. But I know the challenges and struggles that you have faced have made you just really question the validity of a diagnostic label. Now, once you became a doctor, and what did you realize as far as who you were beyond just that label of your diagnosis?
I know it took a lot of work, and I would certainly recommend any healthcare providers to do your own work first. Before we're holding space for a patient, we need to ensure that we have care and neutrality, that we're not bringing any of our own biases or judgment into that. And for me, I went through therapy because I really needed to understand who am I. And I had a beautiful consultation with a patient once. And at the end of our consultation, she actually said, "What are you?" And I thought, what a fantastic question. I've been asking myself that same question for years. What am I? And we can collect all these certificates because we have imposter syndrome. And oh, when I've got that, then I'll be good to go. Oh, somebody's telling me I'm an expert. Am I? Gosh, that's scary. So
Right.
this lady said to me, "What are you?" And I said, "Oh, I'm a general practitioner. I'm a GP, family physician." And she said, "Well, I don't think so, because I've never met anyone like you. Are there more of you out there?" And I said, "Yes, we're a
What are
growing movement. There are more of us coming into our own, because it takes courage to say things that would be deemed foolish by some of our colleagues." But I think the turning point for me with my lupus was, I've got to get better. I can't have lupus and do these things that I want to do. So maybe I could just stop having lupus. And I know that sounds really foolish, but I decide I need to be a different person then. And part of that was, who was I that invited lupus in? And for anybody listening to this, I promise you, this is not meant to invalidate any of our experiences, nor is it to apportion blame or say that one is weak if we develop these things, because it doesn't work like that. So when I went back to who was I when I developed systemic lupus, I thought, I don't know. I don't know who I was, because I was somebody for everybody, but I wasn't me. And I
Yeah.
think we all have a purpose before anyone else has an opinion.
Yeah. And you were so young too when you were diagnosed, and being developmentally immature whenever you're trying to figure out who you are, also being given a diagnosis while you have all these other life circumstances going on around you. I love that your patient asked you, "Who are you?" I love that question.
If you've not been in that experience before, when I do a new course or I have a thought about something different, I'm like, gosh, I'm excited about this. I've come to realize that my next few patients are seeking exactly that. And I'm thinking, I love this. This happens
Yeah,
more
that
often than
it
can
is.
simply be coincidence.
Yeah, it can be truly exciting. I think whenever you don't put yourself in a box and don't limit yourself and don't let your diagnosis
Mm.
hold you back, or not giving yourself these labels for sure. But just that mind body connection, it's so real. And there needs to be more providers out there who are putting themselves first so that they can then serve other people, because what a blessing it is for somebody to just talk to you and then be like, "But wait, what are you? Like, Are there more of you out there like this? That just makes my day.
I think there was another conversation that I had. I worked all my life in the NHS and I was setting up in private practice. And perhaps you've had this same experience. How do I set my prices? How do I value my service? And how will this feel taking money from something for this, for health? And this is not as typical practices as it might be in the US. And this lady came to see me and she said, I've saved up for this consultation. It is an early Christmas present to myself. And at the end of the consultation, she said, that is the best gift I've ever had. How wonderful is that?
Yeah.
And did I do anything special? I don't believe I did anything special. We talked through her life and the challenges that she'd experienced. And we looked at what it would mean to completely love and accept oneself.
Yeah. But also spending the time with her and not making her feel like she's just another number or another person being ran through, which is what I think it becomes to a lot of providers. I don't think that's why they went into the career, but that's what it's become. And that's what patients, unfortunately, have gotten used to. And so when you have a provider that spends time with you, that's always a great appointment. Now, I know, Donna, you think that the innate way of being is to just be healthy and well in every way. And symptoms are simply just information to us. And it should be like the beginning point for us, this diagnosis and the symptoms we experience, which I love. It's not the end point, it's the beginning of figuring out what's out of balance. What do we need to do? This has been an amazing conversation. Is there anything else that you want to leave with us today?
You are only ever one thought away from being okay.
I love that. Just like you decided, I'm just not going to have what happens if I don't have lupus. I'm just not going to have that anymore. That mindset shift is so powerful. I love it. Thank you so much for being here today, Donna. This was truly amazing.
Thank you so much.
Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative.
Hey there, it's Allison. And if you're anything like me, coffee is a non-negotiable part of your day. But did you know that most coffee is loaded with mold, toxins, and pesticides that could be messing up your gut and hormones? Yeah, no thanks. That's why I only drink Purity coffee. It's organic, tested for toxins, and it's packed with antioxidants that actually support your health instead of wrecking it. It's smooth, delicious, and best of all, it does not leave me feeling jittery or bloated. So if you're ready to upgrade your coffee game and support your gut at the same time, grab a bag of Purity coffee today. Your body will thank you. Oh, and because you are part of the What the Gut family, I've got a special link just for you. Just head to puritycoffee.com and use code AllisonGetsWell for 20% off your first order. Cheers to coffee that loves you back. Hey friend, let's talk about something real. Bloating, stomach pain, and fatigue. You do not have to live like this. I know because I was there too. I was frustrated, exhausted, and trying everything, but still felt miserable. And that's exactly why I created my Get Well one-on-one gut health coaching program to help women like you finally get to the root cause of your symptoms, heal your gut, and feel like yourself again. No more guessing, no more Band-Aid fixes, just real, sustainable solutions tailored to your body. So if you're ready to ditch the bloating, boost your energy, and actually enjoy food without discomfort, let's do this together.
Head to AllisonGetsWell.com or reach out to me on Instagram at AllisonGetsWell to learn more and apply today, because you deserve to feel good in your body every single day.